So Vonda Wright has a landmark article called The Musculoskeletal Syndrome of Menopause, and this is groundbreaking. As an orthopedic women's health physical therapist, I'm here to tell you that I know that women have been having joint pain with perimenopause and as your hormones decline, and the tendonitis comes on more. Frozen shoulder happens out of the blue. Widespread joint pain. I did a research study that has not been published. I'm doing my final data collection in 2 weeks. But let me tell you something interesting. During my data collection, I asked women, normal mortals, these people are volunteering to do yoga to help reduce the symptoms of perimenopause. And on day one data collection, what happened is with my patients or participants of my study, is I said, okay, what is your average pain? 0 to 10. What is your average pain? 0 to 10. They laughed at me, all of them. And it's really kind of funny. And they said, well, which body part? I mean, just like generally, like and they're like, which body part? These people weren't coming to me for pain. These people were coming to me to be a participant in a study because they're nice women in my community. Now, true, did they want to move to feel better? Yes. There is a bias that perhaps they had pain and that they were seeking out a treatment intervention. But 40 women walked in my door and laughed at me when I asked what was their average pain, and they all said, where? Then they proceeded to list off the body parts. Then they proceeded to list off the pain. And then it turned out that the average pain of these women seems to be about 4 out of 10 daily baseline. We have normalized women's suffering. And so we had to make the musculoskeletal syndrome of menopause to make people understand that estrogen matters to inflammation, building muscle, building bone, brain health, heart health, our actual weight, our metabolism, a host of other things. Because people didn't really think that being a female with estrogen matters. And I want to remind you, because we're so hormonally complex, we weren't included in studies until the government forced them to include us. And that's why I'm a women's health physical therapist, everybody, because I validate women and help them. And I use science in true changes in behaviors that are doable without shame to help women feel better, because we're not little men.